No more fainting, pass out. Lightheadedness near fainting is the feeling of fainting. Fainting pass out occurs when a person falls to the floor or slumps in a chair due to a sudden and brief loss of consciousness and then regains consciousness. During fainting, the person is limp and motionless. Legs and arms may feel cold, the pulse may be weak, and breathing may become shallow. Some people feel dizzy or dizzy before passing out. People may also experience nausea, sweating, blurred or tunnel vision, tingling in their lips or fingertips, chest pain, or heart palpitations. Sudden fainting is less likely to occur without warning symptoms. Seizures, disordered electrical activity in the brain, and cardiac arrest, complete cessation of the heart, can cause loss of consciousness but are not considered syncope. However, some patients who faint have brief, involuntary muscle twitches, similar to an epileptic seizure. Fainting can occur at any age, but risk factors for fainting are more common in older adults. Causes of syncope: a person does not lose consciousness unless there is a general disturbance in brain function. The disorder is often caused by reduced blood flow to the brain. Sometimes, although there is adequate blood flow, there may not be enough oxygen or blood sugar, in the blood to keep the brain functioning. Although stroke can cause a reduction in cerebral blood flow, it only reduces blood flow in a certain part of the brain. Therefore, stroke almost never causes syncope, except in a very small number of patients where the stroke affects an area of the brain that maintains consciousness. The most common causes of syncope are strong emotion, such as fear, pain, or seeing blood, coughing or straining during bowel movements, standing for long periods of time, sudden standing, pregnancy, use of certain medications, idiopathic causes, that is, the cause cannot be determined. These common causes almost always cause syncope when the patient stands up. When a patient falls, the patient's consciousness quickly returns due to increased blood flow to the brain, although the patient may not fully return to normal within minutes to hours. Strong mood swings or pain can activate the vagus nerve. Excitation of the vagus nerve will widen blood vessels, reduce the amount of blood returned to the heart, and slow down the heart rate. Both factors can cause dizziness and sometimes fainting, i.e., vasovagal syncope or neurocardiogenic syncope. Straining during bowel movement, straining to urinate, or straining to cough can increase chest pressure. Increased chest pressure can excite the vagus nerve and reduce blood return to the heart. Healthy people can also faint when they stand for long periods of time, commonly seen in soldiers, a phenomenon known as parade syncope, because the leg muscles must remain active to help blood flow back to the heart. Sitting or standing up too quickly can cause fainting because the change in position causes blood to pool in the legs, lowering blood pressure. Changes in hormone levels early in pregnancy can sometimes cause fainting. Hypoglycemia, low blood sugar levels, initially causes symptoms such as confusion, lightheadedness, and tremors, but if the hypoglycemia is severe or persistent, the patient can lose consciousness. Less common, but more serious causes include heart valve disease. The aortic valve is most common, a heart rate that is too fast or too slow, a blood clot blocking a pulmonary artery, pulmonary embolism, a heart attack or other heart muscle disorder. Although most strokes do not cause fainting, strokes that involve certain blood vessels at the base of the brain or transient ischemia, TIA posterior circulation stroke, can cause fainting. Likewise, migraines that involve these blood vessels can sometimes lead to fainting.